Hi, Mr. Owens. My name is Lexi. I'm going to be your nurse today. Just going to wash my hands, provide for privacy. All right, Mr. Owens. I hear you're in some pain. That's true. Are you able to tell me your name? It's Bob Owens, and your birthday? 9/22/1933, which matches. So you're in pain. So I have some hydromorphone for you today. Are you able to keep your arm out straight and not be bending it and follow commands? He says he is. If he wasn't able to, or if this is a child, I would have a second person in here with me today. The reason for his central line here is because he is getting chemotherapy as well. So I'm just gonna go ahead and check my first record. So I have Bob Owens. Bob Owens, he is receiving, his birthday is 9/22/1933. 9/22/1933, those match. I have ordered hydromorphine for 1 milligram IV push every 3 hours. And in this, it is already drawn up as 2 milligrams per 1 milliliter. So after doing math, it would be, I'm administering 0.5 milliliters. He has yet to receive it, so we're good to go there. It's also compatible with normal saline, so I'm checking my normal saline, as well as my hydromorphone, and nothing is expired. I don't need to dilute this med today. Also, the rate is 1 milliliter per every 2 to 3 minutes. Mr. Owens, some side effects that may happen today is lightheadedness, sedation, and nausea. Those are all completely normal. But what I do want to watch for is any respiratory depression or an airway obstruction, or if the skin starts to feel cold and clammy. So I'm going to go ahead and get dose accurate. So I just need 0.5 milliliters. Okay. Get the air bubbles out. Alrighty, and then I'm just going to show here. That's 0.5. And now that I'm dose accurate, I'm going to run through my 3 checks. My 5 writes 3 times. So I have Bob Owens. Bob Owens. His date of birth is 9/22/1933. 9/22/1933. He is allergic to morphine, but we are giving hydromorphone. Totally fine. He is getting 0.5 milliliters. 0.5 milliliters. IV push every 3 hours, and he has yet to get it, so it's time. I have Bob Owens. Bob Owens, 9/22/1933. 9/22/1933. He is getting hydromorphine. I have hydromorphone. He is getting 0.5 milliliters. I have 0.5 milliliters. He's getting it via IV push every 3 hours, so the time is now. Bob Owens, date of birth 9/22/1933. Bob Owens, 9/22/1933. He's allergic to morphine. We're giving hydromorphone. He's getting 0.5 milliliters. IV push every 3 hours, so we're able to give it now. Alrighty, and I'm just going to make sure that my normal saline has all the air bubbles out of these. Okay. So now I'm going to go and pull these gloves out. Before I put them on, I'm going to wash my hands. And Mr. Owens, I'm just going to inspect your site. So I'm just verifying that it's not tender at all, and he says it's not. It does not look like it's infiltrating. There appears to be no infection, and it looks to still be attached, and it doesn't look like it's moving in any sort of way. So I'm going to go ahead, touching my glasses, I wash my hands as well. And per my agency protocol, I'm able to use alcohol wipes, and I'm going to clean the hub. My agency protocol allows for it to be 15 to 30 seconds. It would depend on your agency protocol. I'm making sure that that's still locked. So cleaning for 15 to 30 seconds. Okay. So then I'm going to go ahead and I'm going to administer the first normal saline. Go ahead and open the clamp and then administer this. Making sure that the IV still is working. Which it is. So I'll set that aside. I'm going to get another alcohol wipe. Cleanse this again. This time I'm going to be administering the hydromorphone, and that has to be at a rate of 1 milliliter per 2 to 3 minutes. So we're giving 0.5. We'll be nice and slow. Again, Mr. Owens, if you start to feel, because that touched, I'm going to wipe this again. But Mr. Owens, if you start to feel any respiratory depression or you just are not feeling right, please let me know right away. Okay, so I'm going to begin to administer this very slowly, making sure that it happens over 2 to 3 minutes. For time purposes, we'll say that it did, and he's not having any sort of reactions, so we're good there. I'm going to clean this again. This time I'm going to get normal saline again. This one though, I'm going to go a milliliter every 2 to 3 minutes, as I did with the hydromorphone. I'm doing this to make sure that everything got out of the line. I'm making sure to do this at least for 5 milliliters, if not more. Again, doing a milliliter every 2 to 3 minutes. And for time purposes, just speed it up. And then for my final one, go ahead and cleanse the site one more time. Again, depending on agency protocol for how long and what to use. And with this last one, I'm going to be doing a pulse flush, which is at every milliliter. Okay, once I finish with that, I'm going to go ahead and I'm going to clamp this to make sure no infections happen and nothing gets in there. Okay, and how are you feeling, Mr. Owens? He says he's feeling fine, so I'm going to go ahead and clean out my mess, take off my gloves, wash my hands, and I would document the date, the time, how much I administered, where I administered it, how he responded, if there was any sort of reactions to it, anything like that. And I would be done.